Hi, Felix here. I just thought I'd make a quick video following a few things I've seen around YouTube since I've come out from surgery this week. I've been down to have a correction on my erectile device at Spire Thames Valley Hospital with the UK team. Now, I had phalloplasty in 2010, which I've previously done a video about. I was very happy with my phalloplasty. I've always been happy with my phalloplasty. I mean, for me, there's no such thing as a perfect penis. And any genetic male that I've talked to will also say there is no such thing as a perfect penis. They come in all shapes and sizes, they have lumps and bumps, they might have kinks in them, you name it, there's everything out there. So for me, although, I had this ideal picture when I originally looked into phalloplasty of what it should be like, as time went on and I researched it more, I saw more pictures of phalloplasties, more pictures of genetic male penises, and compared to both. The reality is that they could only make for me what they had available from my skin to make. So my penis was going to be fashioned from my arm. They did that, and I'm very happy with my penis. It works well, it's fully sensate, I have orgasms, I can feel hot and cold, I can do everything except ejaculate like a male. But, I haven't got the right bits to do that, unfortunately, so that's how it is. As far as having sex and the erectile device goes, this has been the fourth attempt at my erectile device, and although I have been able to have sex with the erectile device since I had it inserted in 2011 for the first time, since 2011 I've had it replaced. Well, not replaced, in fact I've had it repositioned 3 times, and I've had a brand new prosthesis inserted now, this time with 2 rods, which really I should have had from the start, 2 rods, but that never happened. But we have got 2 rods now, so hopefully everything will be alright, and hopefully, full sensations there, so hopefully when I'm fully recovered, and I will take my time on that one because I don't want anything to go wrong. Everything will be fine and dandy, and it'll be back to sex as normal. And hopefully this time everything will be fine because there's more stability there in the penis, and that should be great. Thinking about other stuff to do with surgeries, I've had a lot of surgeries. I've had 6 chest surgeries because I had it done in stages. I had liposuction 3 times. I had 3 chest lifts. And there's a possibility that I will need a tiny little bit of tidying up in the end. But I chose to do it like this for lots of reasons. Very personal reasons. And also I didn't want to have a lot of scarring. So I knew what was going to be happening, and I knew how long it was going to take, and I knew that it was going to be very tiring because I was going to be having the chest surgeries alongside the phalloplasty surgery. So I had, on top of the 6 of those surgeries, I've had 8 lower surgeries now, and I also had a sebaceous cyst removed in between some of these surgeries as well. So I've had like a lot of surgeries. Now, anybody would think that you know, who in the right mind would actually go through all these surgeries? Well, anybody who out there who is like me, whether you be F to M or M to F, will know why we go through these things. Because we have to be right and we have to be feeling comfortable in our own bodies. And I would do it again in a blink. I would go through all the same amount of surgeries. I have no regrets about the surgeries I've gone through. I'm happy with my chest. Mr. Neeshaw has done an amazing job from the size I was to where I am now. And the UK team have done a fantastic job really, although obviously it would have been nice if we could have got the erectile device in the first place. You know, 2 rods, all hunky-dory, and no messing about with the same rod which was defective after the first time it was removed, and I only found out that I'd had the same one put back in again after it was removed because of infection and hematoma. I had the same one reinserted 6 months later, but they'd kept sterile in the fridge. So maybe if that hadn't have happened, I wouldn't have got where I am now and had to have the whole prosthesis replaced. But besides for that, I'm very happy with the UK team, the nurses, the doctors. They've all treated me very well, to be honest, and fair to them. And this time when I went down for surgery, they was really good. I explained how I felt. They was quite surprised at me because I usually go there and I breeze in, breeze out, take it all in my stride. I'm not particularly bothered. You know, I put myself in their hands because I trust them totally. And that's it. But this time, because there'd been so many technical hitches, I was rather nervous. Helen was with me all the time, and I expressed my concerns, and what they said to me was that, you know, when they replace it, it'll be perfect after the surgery, but they can't guarantee, which is absolutely true, whether my skin will stretch, you know, during intercourse, or even with it being swollen now, when it goes down, it may have stretched a little anyway, because the erectile device is semi-erect until I go back to see the surgeon on the 15th. So they can't guarantee that my skin's not going to stretch. So they can't guarantee whether the head of the penis will actually not droop over the end of the rods. They can't guarantee that. I realise that, and I'll take that on board. And, you know, if that happens, and I've talked to a friend recently and he said, you know, 2 years post-op of his does droop a little bit, but that's with wear and tear, you know, lots of sex and lots of, you know, hand jobs and things. So, you know, it is going to happen, it is going to stretch, and that's the reality. So anyway, that's that bit sorted out. So as I say, I'd do it all again in a blink. It's not an issue. I wouldn't do it any other way. I am very tired. It has caught up with me, and it certainly has showed that on this surgery, because my body's reacted totally differently to various things. But I feel I'm getting there, you know, I'm getting there. So that's good. As far as going through the process and work, I've worked right the way through the process because, you know, at the start I was the breadwinner, and luckily now, you know, as I've gone through, my partner, we shared that financially. I'm still the breadwinner on the main, and we both contribute as equally as possible in all areas, which is good. It is difficult because you do have to have time for recovery. You do have to have an understanding workplace. That's why for me, being in stealth over my operations or what I was going through was a no start in terms of work, because I wanted the protection of the law. I wanted the protection of the Gender Recognition Act and etc. etc. all the other laws that are pertaining to gender reassignment. I wanted that protection, and if I had been stealth, I may not have been able to fall back on these laws and use them to my advantage when things got rough recently. Because on this operation, work were a bit funny about it, but as I pointed out to them, I am protected by the law, and if you know, push come to shove, I would really use the card if I had to, and if I felt I was being treated unfairly, which I've never done and I never would do. I wouldn't just use it for no reason. But if I felt that I was being treated unfairly based on my gender reassignment, based on my, you know, trans history and what have you, then I would definitely pull the card, and I would definitely have, you know, the law on my side, and I would use the law, and there's no doubt about that. So if there's anything anybody wants to know, if I can help anybody with anything, you know, just fire away. My email's felix.familiar@hotmail.co.uk. If you email me, I can give you my phone number, you can text me. I'm on Facebook, and I am Felix Fenlon on Facebook, so you can contact me on Facebook as well. Helen Laws is my partner. She's on Facebook. We both work very closely in the transgender community. We help other trans people. We run support group and an advocacy service. So, you know, if anybody needs any help or advice, feel free, shout, and if we can help, we will. If we can't and we feel we need to direct you to somebody else, we'll do that too. So, anyway, any questions on me musings about surgery or anything else, feel free, and I look forward to hearing from you. Okay, bye for now, guys.